Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab, all on your time, live or on demand. This is CSIS Online.
And good afternoon. I'm Jay Kurtzer, Director and Senior Fellow with the CSIS Humanitarian Agenda. On behalf of the Center for Strategic and International Studies, welcome everyone joining us today. I'd like to remind everyone that they can still submit questions for our panelists directly through the webinar's Q&A function, and that this event will be posted online on the CSIS website about 24 hours after its conclusion. The COVID-19 pandemic created new and in many cases unprecedented challenges in the provision of humanitarian assistance, particularly generating new access constraints that arose from global lockdowns and travel restrictions. As a result of these additional access constraints, national and local humanitarian actors were tasked with increased responsibility in the delivery of life-saving assistance to vulnerable populations. Yet despite the increased ownership and management of humanitarian response, the growth in these local actors' responsibilities was not always accompanied by similar growth in their financial and operational support. The United Nations University Center for Policy Research recently published a report on COVID-19 and humanitarian action, highlighting the challenges to humanitarian response and increased localization during the COVID-19 pandemic. The report was co-authored by one of today's panelists, Dr. Rebecca Brubaker, and her colleagues at the UNU Center for Policy Research. So we're very pleased to be having this discussion today, guided by the overarching themes and findings from this report, allowing us to focus on the challenges and lessons learned from humanitarian action during the COVID-19 pandemic. With that brief introduction, I am pleased to introduce the rest of our panel who will help us unpack these issues. First, Dr. Rebecca Brubaker is a Senior Advisor and Project Director at UNU-CPR, where she focuses on issues related to conflict prevention, sanctions, Security Council affairs, migration, and refugees. Prior to joining UNU, she also led and co-chaired the United Nations Interagency Working Group on Sanctions. Next, we have Eranda Wijewickrama, leader at the Humanitarian Advisory Group in Melbourne, Australia, where he conducts research and evaluations and provides technical advisory support for the humanitarian sector. His work primarily focuses on localization as he leads the Humanitarian Advisory Group's localization stream. Finally, we have Smruti Patel, founder and co-director of the Global Mentoring Initiative, where she focuses on capacity strengthening of local and national NGOs. She brings extensive experience in the humanitarian sector and previously served as one of the evaluators and author of the Tsunami Evaluation Consortium study on the impact of international relief responses. She was also the interim director for the Network for Empowered Aid Response, NEAR, where she led efforts to build a network to raise the profile of these national and local NGOs in humanitarian and development work. We're really grateful for the three of you joining us today, and I'm really looking forward to this conversation. I want to now turn it over to my dear friend and colleague, Kimberly Flowers, to moderate our conversation. Kimberly is the Executive Director of the Goldfarb Center for Public Policy at Colby College, or for Public Affairs at Colby College, and is also a Senior Associate of the CSIS Humanitarian Agenda and Global Food Security Program. Over to you, Kimberly.
Thank you, Jake, and good morning, everyone. We're thrilled that you're with us. So this is going to feel really fast to have such great experts to talk in 45 minutes, but I want to remind you, just as Jake did in the beginning, to feel free to engage with us by adding in questions that you have in the Q&A box down below. You'll also see that in the chat section, there's a link to the report that really is part of the public launch, and that's why we want to start with Rebecca. For those that haven't read the report yet, and I'll say to those that haven't read it, it's only about 20 pages. It's easy to read, but there's a lot packed in there. So I'm going to ask you to do the impossible, which is try to summarize it. But tell us, Rebecca, what are the key highlights? What are the things that about the report that you think people should know that haven't seen it yet, particularly focused on the challenges in terms of the pandemic and how that's created or restricted or created opportunities in humanitarian access?
Thank you so much, Kimberly. And thank you also to CSIS for giving us the opportunity to talk about our report today. Just before fielding your question, I wanted to acknowledge my two co-authors who are in the audience today, Adam Day and Sophie Huvé. To your question, in my attempt to summarize it in 2 to 3 minutes or less, there's 4 points that I want to draw out from our report. The first is that we found, perhaps unsurprisingly, that COVID did impact access in 3 ways. It exacerbated existing access constraints in terms of, for example, mobility within countries. It also created new access constraints, access to countries in general, or even a rise in anti-foreigner sentiment that complicated access. And it also, in a few instances, reduced access constraints when it came to, for example, access to certain detention facilities. But what we realized as a second point is that where access was further constrained, it primarily further constrained international entities and international staff of humanitarian organizations. So that as a result, that led to an undue or increased burden being placed on national and local actors to step in and to fill that gap. Now, this was both a good and a bad thing. It was a good thing because this is something that the sector has in fact been calling for a long, powerful voices within the sector have been calling for. But it was a bad thing because that additional responsibility was not matched, as Jake said in the introduction, with the operational, logistical, financial, and just even protection support in terms of PPE. So in our report and our recommendations, we begin to look at some of the ways that local and national actors could have been better supported through this pandemic. And as just a fourth concluding point, we acknowledge that this pandemic further exposed inequalities that exist in the sector and renewed calls for change. And we conclude that this time in a crisis, as all other reforms within the humanitarian sector have come in moments of crisis, we say this is an ideal time to revisit that localization agenda and to push forward reforms that as of yet have been delayed.
Such a great point that big change can come out of crises, because we all want to hope that there's something good that can come out of this pandemic. I want to turn to you, Eranda, next, because I want to talk specifically about Mir and Mar. You also recently produced a report or published a report related to the crisis in Mir and Mar, but of course, anyone, even if you're barely paying attention, know that there's this huge crisis happening right now there with the military coup. So talk to us about how you've seen what Rebecca was referring to on the ground in Mir and Mar, and how what's happening there that has related to localization or the impact on local partners.
Thanks, Kimberly. Before I start off, I just want to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of the land where I'm talking to you from, and I take this opportunity to pay my respects to their elders, past, present, and emerging, and all to all Indigenous people who continue to fight for their sovereignty. Having said that, so as you mentioned, Kimberly, it's everyone around the world, it'll be impossible for them to miss out on what's going on in Myanmar. I guess the context in Myanmar that people the humanitarian actors were operating in, especially local organizations were operating in, was quite bad to start off with, especially given COVID and the risks that they were facing. And since the coup, things have only gotten worse, especially for local organizations and local staff. I think Rebecca already touched upon some of those challenges, but a couple of examples I would want to raise in terms of some of the challenges that they're facing is a lot of these local organizations or civil society organization staff are known activists within the communities, are very involved in the CDM. So a lot of them are facing persecution. So, arbitrary arrests, or, the military is targeting them, their organizations are being targeted. Some of the local civil society organizations or local NGOs have seen their financial records seized by the government, and they're trying to use that to intimidate them in reducing their engagement. But I think, as Rebecca highlighted, what COVID has done is it's exacerbated a lot of existing issues, and the coup has made that worse. During the pandemic, it was the local staff of international organizations, and especially the smaller CBOs or the local organizations who were at the forefront of the response. So they were working with the communities. They were helping with managing, for example, the quarantine facilities. And they are now facing the biggest threats from the coup itself, because local staff don't have the option of repatriation. Now I think potentially almost all international staff with families have been repatriated. About 50 to 60% of international staff have already been moved out of Myanmar, and most of them are operating from Bangkok. But local staff of organizations or local organizations don't have that option. So their only possible option would, has been, and some of them have taken this option, is to move into KNU controlled territory, just because they have been targeted by the military. And even so, then they come under the risk of getting bombed through aerial raids. And maybe I'll finish off with one final point as well. I think we can go on in this discussion and the challenges that people are facing for quite a while. But one of the other major issues in terms of access and humanitarian response is also the government has basically frozen the banking system, the financial transfers. So local organizations are having immense trouble in accessing finances. International organizations are also facing restrictions in transferring money. So some of them are now resorting to informal money transfers that were there, I guess, 10 to 15 years ago. But because of this issue, basically, some of the local organizations have had to stop operations or had to stop programming. And, with some of the staff having to sleep in different places every night just to be, safe from the military, some of the local organizations are not, and the international organizations also, who heavily rely on their national staff, have not been able to, move ahead with their programming as they would have thought. So maybe I'll stop there, but happy to go back to any specifics if you have questions.
Thank you so much, Eranda. Smruti, I have 5 questions here. I'm trying to figure out how to narrow. I don't think I can narrow it down to less than 2, because I have 2 thoughts that I just have to get out for you. One is, as we think through, well, talk to us about, when we talk about localization and local partners, tell us your thoughts and what does that relationship look like? As you look at local partners and localization, how has it always been and how is it now? So talk to us a little bit about that. And then also, I would like you to take us in a positive direction a little bit. So walk us through, has there been any opportunities here for improvement? Has the pandemic created something that could be good in terms of equity of voice, or how local partnerships are working?
Great, thank you. And thank you for this opportunity to be able to share my thoughts. And Brubaker and others for this report, because I think it's really important to highlight, how local actors have really taken the stage in a way, right? Because there was, because of the circumstances. So 2 things that I wanted to emphasize. Firstly, that we know that structurally, there is and there has always been inequity between international and national actors because of the funding, because of power relations and others. And in a way that, that's kind of, in a way, what impact has the pandemic had on that? What we see on the ground is actually, we always hear that local actors have no capacity. That's the kind of the negative narrative that come out normally. But through the pandemic response, you saw the solidarity at ground level in the countries, right? Many citizens and NGOs and CSOs came together and really showed what civil society is about and really help out the people in need, their own communities that really, and that's what they're there for. So in that way, it was really positive, right? It really gave them the, it showed actually that they can do the action. Of course, on the other hand, Brubaker has already pointed out in her report that actually, if they had had the funding and the resources, they could have done even better, right? Even a more quality job. So in a way, where the partners were supported by their international partners with flexible funding, right? So being able to change, because remember, perhaps some of the funding was already allocated to some kind of longer term development or other plans, right? And where they were able to switch that to the pandemic response, it helped them, the local organizations, to do better response and be able to fit the needs. There was, I think the other issues have been from before as well, and this comes to the inequity, the decision making, because I think Brubaker said that when when the pandemic started, the expatriates were basically expatriated out of the country, but that meant all the decision-making power went with it. So what we heard is that many organizations were then stuck because they couldn't get the decisions about switching the funding or making different decisions so they could move forward and actually do the response. So that was a big issue, other than just people leaving. So there are such huge consequences to this. But I think this also points to how do we look at the future now? Because if we see that actually we feel there was a paralysis because of expatriates going out, a lot of things bit stuck, even where the funding was allocated at global level, it wasn't being filtered quickly so that the response can happen. So we need to think about the future and think about how can we make sure that we really are, we just don't talk about localization. We should be talking about decolonization, because for us, the structural change in the power balance and the decision making is so important. It's not just about funding, right? We need to make sure that we deal with that issue, because an expensive expatriate driven response now, it's no longer viable. If you think about it, through this pandemic, we've seen the funding shrinking because the other funding is going to other priorities in their own countries. So the aid giving countries. So in the long run, we really need to think about how can we create a more sustainable system with local organizations leading at local level, because this is the fastest way of responding and is more sustainable than all the time, environmentally and otherwise, right? All the time flying in expensive response coming from, of course, there's some expertise needed. So I think it's really looking at what is the role of the international and national actors coming together to have the most effective response. And for that, you need to really relook at the role and responsibility of international and national actors. And I think also look at the power imbalance. And this is absolutely key. Unless you look at that, and we need to rebalance that. And I think this is the opportunity we need to take to do that. I'll stop there. And if you have other questions, I will come back.
Thanks. I think that flows really back to Rebecca, because when you talk about that more sustainable system, right, and localization, as Rebecca mentioned, this isn't a new thing, right? I mean, anyone who's in the humanitarian sector for some time, it may have been pushed through the Grand Bargain and other things, but this isn't new. But now it's kind of forced. It happened in a new way. So Rebecca, I'd like to turn back to you to think through a couple of things. One is whether there's kind of innovations that have been accelerated through this crisis, or opportunities there, and just your thoughts on change, right? Like, do we really see that the system can change? What are some examples of that, or your thoughts around, big systemic changes, not easy, right? So just some more of your examples or thoughts on that shift or change that could be happening.
Sure, it's a good question, Kimberly. There's been a lot of discussion around this. Our report simply adds to what's been a very rich and ongoing discussion. In that discussion, there are those who push for large systemic change in the direction of further consolidation within the sector to reduce overlap and inefficiencies, and in that way, free up more funds to invest in local and national entities. There's another part of the sector that argues for more networked humanitarianism, where you connect more directly those with the funds and those who will be immediately implementing them, with this intermediary lever helping to manage those funds, but doing less implementation. Now, both of those structural changes would need quite a lot of political will, and political will can be generated out of a crisis. In our report, we look a bit more at technical fixes, more short to midterm, such as, to give some examples, around better supporting local actors. To donors, we talk about better incentivizing consortia or twinning approaches between international and local actors, or increasing pooled funding and then access of local actors to pooled funding. And this is something, for example, that OCHA has done in the context of country-based pooled funding. They increased the percentage that was available, channeled to local actors during the pandemic. They also made SURF funding available via IOM to national and local actors in a way that it had not been before. I think on the level of these intermediaries, these large INGOs, international NGOs, there's been a lot of discussion about further equalizing contracts. So donors have over time increased multi-year funding, the flexibility of funding, given more discretion and anticipatory funding. There are questions about whether or not those same privileges have been passed on to local partners by those intermediaries. So that's something that we discuss within the report. And then also just to follow up on points made by Smruti, this idea of adding more chairs to the table at various levels, whether it's the governance of international NGOs, to have individuals on governing boards or in leadership positions who perhaps themselves have come from situations of conflict and lived that and bring that experience into decision-making about how best to partner in these various contexts, or even just when it comes to groups within countries, to ensure that those who are gathered at the table, the meetings are conducted in languages that make them accessible to those involved. So these are smaller suggestions within our report, but I think as a place to start, and good work has been done. If I could, Kimberly, maybe just one point to say, we're not in the report saying throw out that it should be complete turn to localization. I think there's just to draw out, we do see comparative advantages that various actors can play. So it's a bit about thinking through those comparative advantages and making sure they're being maximized. So to just briefly list some of those, as Eranda and Smruti have been bringing up. I mean, with international actors, they're very good at bringing visibility to issues and bringing funding that follows that visibility. They also tend to have a great absorption capacity when it comes to bringing on funding with short notice at large scale. There also are considerations in terms of perceptions of impartiality on the part of an external actor coming in to a sensitive political situation. Now, on the flip side, in terms of local and community-based actors, there's deep knowledge of the context factors, of relationships, of political sensitivities, there's language, there's just physical proximity, as has been discussed. And in the flip sense, there's also increased access. Now, in the context of COVID, increased access, one of the reasons for it is that we saw a rise in anti-foreigner sentiment linked to the pandemic, which in turn facilitated that further access. So just to bring up that point to say, while we are calling for changes in this direction, we do think it's also important to examine the comparative advantages of the diversity of actors that are acting in this space.
Yeah, you took my next question, which was B, and I'll say I'd like to get Smruti's and Aranda's thoughts on this, because I'm thinking through, like, okay, if you're working for an international NGO, like, do you feel threatened by this? You know, like, what would you say to, especially, I would say, Smruti, I want to start with you and then Rhonda, but like, what would you say to, you know, an executive, an international NGO who hears this, who sees this, like, what message is it to them of like, what policy changes really need to shift, organizational just to focus and empower more local partners without the organization itself feeling threatened. And your thoughts on that as well as that divide that you see between the two partners, specifically Mir and Mir and Mar, and how that can be better balanced. But let's start with you and then go back to Eranda.
Okay, so, this is not one thing or another. I think it should be about appropriate role for each, right? And that complementarity. But what is at the center of it is equitable relationship, about making decisions together, right? Because at the moment, because of the funding and money brings power, all the decisions are made by the international partner. So I think, local actors recognize that they need, international partners as well. But what role should they play? It's not of an implementer deciding everything, because this is one of the challenges, right? Everything is pre-decided. So by the time implementation takes place, it's just being a delivery boy, right? It's not really taking responsibility for your own country and for your own people, right? So it's really important that things are decided together, and the local actors actually get the funding that's necessary to do quality job, and also make sure that they can build sustainable institutions that can carry on response in the future. Because if this happens again, we don't have to wait for the internationals to fly in. The local actors are already actually, if you look at the world and the number of I would say disasters that happen all over the world, it is the national actors who are responding. It's not internationals. Internationals are only really responding where there's money. When the money comes, then they are there. Money is not there, they're not there. And it is the local actors who have the load, right? And so I think we need to take that into consideration. What is the appropriate role for both? And look at that issue of equity in decision making. It's absolutely key. I think the other thing that I would focus on is attitudes and behaviors, because change takes time. But the attitude with which you're responding, how you are dealing with your partners, how you're being with each other to start with, right? We already know there are issues in how people are treated within organizations. We know there's whole issue of racism in our sector, prejudice and other inclusion issues. So that also affects local actors, right? So we need to deal with these key issues to make sure that we can move forward. But there is a role for both. Nobody will dispute that there is a need for both, but it's about complementarity, and it's really about making sure that when we now move forward, that we are doing it in the right way. In their country, you're a guest, you're not the master. I think that's the message I want to leave behind.
Great. Eranda, your thoughts?
Yeah, maybe a few things. Just to start off with your question on the executives, I guess, from international organization. I'd also like to flip it in a way to say, how are executives of international organizations assessed? Are they assessed, do they get a good rating if they close down offices and phase off operations, or are they assessed if they bring in more money? I know there are a few organizations, a few INGOs who have been trying to change their operational modality, where they move to a partnership model, or they increase national staff, or they simply close down offices saying, I think we are not needed here. But I think Smruti highlighted that as long as there is money, there's always international organizations present, and that's I guess an attitudinal change that needs to happen. I think there is that, especially at a field level or operational level, or there is recognition and there is some change that's happening at a global level as well, but there is a long way to go from my point of view. In terms of, I guess, what it means if you're looking at the context in Myanmar, but also, I think we can look at the Pacific also provides a number of examples of how local actors and local organizations have been able to take the lead. So if we look at TC Herald that hit Vanuatu and Fiji last year, and TC Yasa that hit Fiji and a number of other countries this year, all of the responses happened in a context where the borders were closed. So, and as soon as the borders were closing down with COVID, you saw a lot of the expats immediately moving out because the health systems in the countries were considered inadequate, right? But for example, if you look at the TC Herald example, it was mainly run by local organizations or local staff from international organizations, with with a lot of the international staff dialing in potentially from Australia or providing that support. And there's been a lot of contrast made to that compared to TC-PAM, which happened in 2015, when there was so much of money that was made available. There was a huge influx of international organizations, and people who were there talk about how all the houses in Port Vila were basically booked by international staff because there were so many people coming in to respond. Whereas with TC Herald, it was primarily local staff and local organizations leading the response itself. And maybe a couple of other points on the challenges also, Kimberly, one is that going back to Myanmar, one of the examples is that the COVID impacted the entire country, right? Like all the regions, but the local organizations were present in all areas, but the international organizations were again primarily operating in the area, the major humanitarian regions. So like Rakhine, Chin, or Kachin, because that's where the finances was. And there was very little finances flowing, international finances flowing to the other regions where there was less international presence. So it was the local organizations there who had to take on the responsibility through either community funding or remittances to respond. And I guess the other side is also that these smaller organizations receive very little funding. So you have when we talk about localization, you have all these numbers that international organizations present, but you'd also see, if you go down to the details, a lot of that money is also transferred to a number of big national organizations in those countries who basically function as pseudo international organizations because they've had that capacity support, right? They've over a number of years, they've worked with international organizations, they've worked with the UN, and they've built their skills, their processes, and they've now established themselves as a major actor or major player in the humanitarian sector. So they become the go-to local partners, whereas the local organizations who are on the front lines, the smaller organizations, don't always get that recognition or the finances. But I think that is part of the longer term process where these bigger organizations have a role to play in supporting the smaller CPOs or the local NGOs. I'm happy to stop there, but again, as I said, can go into more details if needed.
Thank you. I'm going to pull in some questions from the audience for our last few minutes. And I actually think, Eranda, you just answered the last question, but I just want to throw it out to see anyone else has any other things they wanted to add. And the question is around assuring accountability of local actors in relation to funding, especially in challenging situations. So any other thoughts that any of you want to add? I mean, I think you did a great job just now of answering that, but anything else in terms, I think, accountability, especially, and if we see change, we keep saying that local partners are taking the risk, but not being financially compensated. And if that shift can happen, how do you make that shift in addition to making sure that they are still accountable for it? Any other thoughts on that?
Yeah, quickly come in. So it's really interesting when you analyze this thing about accountability, because if organizations have been partnering with international NGOs for, and I know this for a number of years in many countries, right? So 10 years, 15 years with the same organization. But this time, if they were not accountable, they would not be partners. So on one hand, this continues and continues. And then when it comes to giving responsibility, they say, well, it's about accountability. So sorry, but that argument it can't be valid, right? They have some of them. So I give you an example. In Bangladesh, there are organizations who get direct funding from donors for other programs, not humanitarian, but others. And they are well accountable. They're 5 times bigger than international organizations, right? So they can be accountable. But when it comes to humanitarian funding, then they don't get direct funding. So I think there's a problem there because it's, we seem to apply different standards. So that's one thing. I think the second thing is, and I wanted to go back to what Eranda had said about the executives, right? And you had mentioned like, how do they move their organization on? They have taken on I think they have taken on the commitment for localization, many of them with the grand bargain commitments and Charter for Change commitments. If the tone from the top and the policy and the guidance doesn't go down to the ground, then nothing much is going to happen. Sometimes they're saying, oh, it's actually the country directors who make the decisions. And what we know is, and we've heard this from many of our alliance members. So I'm also part of Alliance for Empowering Partnership. It's a group of local and national organizations who've come together to advocate for localization. And what we hear is that actually often it's the national staff of international organizations who become the gatekeepers. And that's where the blockages happen. So we need to also, so the executives who want to really make a difference need to work on those people who have those decision-making powers at country level. That how do you, work with partners in a respectful manner and an equitable manner? It's absolutely key. And I think you said earlier about how are they, also the directors at country level, how are they, how are they being examined in terms of their process and progress, right? It's always been by expanding funding, right? Or expanding their operations rather than, making sure that they're actually really supporting the partners and doing a really effective job. So it's also about our incentives in the system of that are given to the directors about how are they, how they're, how is their tenure seen, right? What we see at the moment is huge expansion of raising funds in the country. So that also shrinks the space for local organizations to be able, because there's only so much finite resources. And they're also, because they have such big machinery, they're able to raise funds. So for example, from India and other countries, they're raising funds there. But that means that it shrinks the market for the local organizations who can't compete with that kind of machinery as well. So there are several things that can be done. Instead of them raising so much fund, perhaps they can also capacitate local organizations to do that, or have those facilities available for their local partners to be able to do that for the future. And this, I feel like it's also about what legacy do you want to leave behind? It is about legacy. And what positive legacy do you want to leave behind? Instead of expanding, and we've seen this now, more and more international organizations are opening offices in countries, and they're registering themselves and then calling themselves national. So that means that the space that was there for the local organization is shrinking, both policy, but also operational space.
Thanks. Rebecca, as you add some thoughts to this, I'd also like you to think if there's any example of local regulation, I would even say governments that help keep partners accountable. Are there examples of that? That's a question also from our audience, from Emmy Simmons, who's also a CSIS affiliate. Rebecca.
Thanks, Kimberly. I think the line was breaking up a bit, but I'll work with what I heard. To just, I guess, add 2 points to this conversation. One perspective that we heard a lot in our interviews is that, yes, of course, there's a need for accountability and transparency, and it's an excellent question. But that at times the standards for transparency vary based on the actor, and sometimes the established partnerships aren't held to that same standard of transparency at time as you work your way down the chain. I think also it's important to acknowledge that, accountability, transparency, and the financing model, it takes time, it takes staff, it takes effort. It's particularly when you're dealing with quite large funds. And so I think that's why bringing the conversation back to working with comparative advantages and what is really the appropriate role for the intermediary to play here. One recent example that we've seen was Oxfam's initiative in Somalia, where I believe they're managing funds but not doing the implementation, as one to consider where they can take some of that load in terms of handling the financial compliance and tracking, but that it's more of a partnership model where they leave more of the decision making to the local partners. And then just to echo the excellent points made by my two fellow panelists, another perspective that we heard often mentioned in our interviews was this idea that, shouldn't it be about planning for an exit rather than planning for growth, and thinking through what the implications might be for that model.
Kimberly, if you don't mind me jumping in quickly on...
Please go ahead.
I guess a couple of an example in terms of regulation on financing, I guess, is what we saw with TC Herald in Vanuatu. Was the Vanuatu government came with a regulation saying that if if donors are funding international partners, they need to match that amount in funding to the government. So DFAT funding, I think they channeled 5 million AUD at that time initially, and I think that was split to $2.5 million to international organizations and 2.5 million to the government to lead their own response. And just to add another point on the accountability aspect is there have been discussions like I know the NGOs, the Australian NGOs here have been discussing about having common accountability processes where if one if a local organization goes through the process with one organization, maybe that can be considered across all organizations. I think that's a process that they are using in Afghanistan with the Afghanistan Humanitarian Fund, the OCHA managed pool fund. If local organizations go through that approval, they can that can be considered as them meeting standards for other organizations. But also looking at these pool funds, it also depends on how engaged and how open they are in terms of local organizations being represented on boards. Like the Mir and Mar Humanitarian Fund actually provides some good examples of how inclusive they have been. They've tried to match. They've tried to have equal numbers of local organizations, international organizations, UN and donors, and they bring on national staff to individually or separately engage with the local organizations to make sure that they have a proper voice and representation. Whereas in some of the other OCHA pool fund boards, that representation is actually not there.
Thank you. I wish we had more time. The conversation always gets the best, I feel like, as we start to wrap up. Some great comments and questions from the audience that I wish we had time to include. I'm sorry that we don't. But what I want to do, and we still may end up going 1 or 2 minutes over, but I want to have 1 minute each of our panelists give a last thought. And I really mean that's a flash minute, right? Or what's your last thought? It can be an action item. It can be one message that didn't get across or re-emphasizing that we've already discussed. And I'm going to add my 1 minute too. Mine is, if you didn't look at the link at the beginning, it was in the chat box, to look at the report that Rebecca and her colleagues wrote. Check that out, read the report, or at least go to the end of it and read the recommendations. That's what I'm going to say to our audience. We're going to go backwards. So I'm going to start with Eranda, Smruti, and then we'll end with Rebecca. Eranda, I know you just talked about any other final point or last thought for our audience very quickly.
Yeah, I'll keep it short. So I guess for me, the one leave behind would be for international organizations and everyone involved to be more conscious in terms of the risks and the challenges that the local actors and local staff as well of international organizations are facing, and be mindful in terms of those considerations when you're planning, when you're working with them in terms of partnerships, especially in terms of financing, and actually recognizing the risks and the challenges that they undergo to provide the support to people in need.
Smruti, go ahead.
Yes, so my one would be to move forward, suspend your judgments, right? Because we come with a lot of judgment about who the locals are and who, you know, how they are and all this. Go with your open mind, open heart, and open will. If you want to change things to go forward, we need to make sure that, you know, we really recognize and respect each other's capacities and work in an equitable partnership. And let's start decolonizing the aid environment so that we are really respecting everybody in that space. It's a big ecosystem, and let's look at it as ecosystem, because that's the only way it's going to work.
Rebecca, final word.
Thanks, Kimberly. I think just to reiterate a point from the beginning, to see this crisis as an opportunity for change and also as a reminder of why there's a need for change in this sector. And I'll leave it there.
Concise indeed. Thank you. That's wonderful. For the audience, if you missed the link at the beginning, know that the link to the report is also on the CSIS page. So when you go to look at the link or for this event or afterwards, the link will also be there. Thank you all so much. We appreciate our audience, we appreciate our speakers, and we appreciate digging deep into a very important topic. Have a wonderful day, everybody. Bye-bye.